Hello, my name is Dr. Jessica Jarvis, and today I have the pleasure of giving you a brief overview of my team's study, which was recently published in Volume 60, Issue 8 of the DMCN. This study was a part of the We Cover study, which was a bi-center prospective cohort study that aimed to examine functioning for children who are recovering from critical illness. Each year in the United States, over 230,000 children are admitted into a pediatric intensive care unit, or PICU. Now, the good news is mortality rates have decreased drastically, and approximately 97% of children survive their PICU admission. Unfortunately, we have also seen an increase in the number of children that are discharged from a PICU with new functional impairments. However, the majority of studies to date have examined functioning following a critical illness at the level of capacities, such as the child's muscle strength. However, in rehabilitation, there are two additional ways that you can consider and measure functioning. There is also at the level of activities, such as the child's ability to independently perform a discrete task. And there's also at the level of participation, such as the frequency and involvement in which a child takes part in a meaningful set or series of daily life activities. The We Cover study was the very first study to examine functioning following critical illness using a measure for all three different aspects of functioning. The team followed 180 caregivers who had a child that was admitted into a PICU for over 48 hours and then followed them for 6 months following their PICU discharge. For our specific study that we're going to talk about today, we examined participation in the home for those first 6 months following PICU discharge. We used hierarchical linear modeling to examine changes in home participation across time and between groups of children with good overall functional capacities pre-PICU admission and abnormal functional capacities pre-PICU admission. We found that children's participation in home-based activities did not significantly change during those first 6 months, suggesting that change in home participation may be a very slow process for children recovering from critical illness. We did see that children who had abnormal functional capacities before their PICU admission had significantly lower participation frequency levels and involvement. We also found that there was a significant interaction between time and pre-PICU functional capacities on the child's involvement, suggesting that the trajectories of change in home involvement will differ for children based on their pre-PICU capacities. And lastly, we found that caregiver-reported environmental supports were significantly associated with increased participation and involvement. These findings are similar to what was discovered in the We Cover main study analyses, which examined recovery at the level of activities. They found that caregiver support or responsibility for caring for their child in specific activities was the slowest area of recovery. So perhaps this lack of change that we saw in home participation is related to caregivers being unable to shift some of the responsibilities for those activities to their child during those initial 6 months. Altogether, these findings highlight a possible opportunity for innovation in some focuses for rehabilitation. Specifically, there's an opportunity to develop some compensatory and environmentally focused rehabilitation interventions in order to support caregivers in facilitating their child's home participation during those initial months of recovery from critical illness. Currently, our team is also examining the number and types of environmentally focused strategies that caregivers have to support their child's home participation, as strategies are something that is captured in the participation assessment that we used in We Cover. We expect these results to further inform the design of participation-focused rehabilitation interventions for this vulnerable population. We thank you for your time and for your interest in our work, and I really hope you'll stay tuned for more.